US. So this morning, how to improve your game and why it's just simply so important to get out and spend time outdoors this spring and this summer. Coming up now on the Morning Medical Update. And good morning, everyone. I'm Jessica Lovell. It is Friday, April 8th, and we are live on location out here in Overland Park at our Sports Medicine and Performance Center here with the health system. So glad you are with us. So I want to show you some gadgets and some cool stuff that's going to help you improve your golf swing and your golf game and ultimately keep you healthy. So we're standing here with this net. And this is going to be a way for you to analyze your golf swing. So I'm all geared up here. I'm all strapped in. I've got 4 pieces strapped in. That's going to analyze, Ryan, it's going to actually show me what I'm doing, hopefully right, not what I'm doing wrong. Correct. So nothing like having what you're doing wrong right there on the screen for you. So, and then you can see this little gadget down here. So this technology is going to kind of monitor what I'm doing and tell you how to do it right, I guess, because I'm sure I've been doing it wrong for years and years. But it's not just about fixing your numbers out on the golf course. It's actually about staying healthy in the longevity of playing golf. So making sure that that swing translates into making sure your body is in alignment. So we're going to talk all about that here in just a bit. But we're going to head into the studio this morning and get a check on our COVID count with Dr. Dana Hawkinson. Good morning.
Hi. Yeah, enjoy that out there.
Hi.
Right now, we still have lower numbers of active infections in the hospital. We have 9 active infections with 1 in the ICU, 1 on the ventilator, and 33 in that recovery period. And again, just so that you know, if our numbers change drastically in the next, say, 5 to 6 days or over the weekend, just understand that we are going to be going away and moving away from testing everybody that comes in the hospital with PCR to look for SARS-CoV-2. So some of our active numbers may change. We still will be testing those people that we suspect have illness or if they are complaining of symptoms.
All right, Doc Hawk, thanks so much. We'll check in with you here in just a bit. Let's check and see if we have any reporter questions on the line. I think we are good. Alexis, good morning to you also, by the way, there in the studio.
Good morning.
We'll
I'm so
check in with
excited
you
to
to get
see
our
your
community
swing.
questions. Hey. I'm sure you are. I'm sure you are. So make sure you get your questions sent in to us on Facebook, on YouTube, and on Twitter, and also at the Medical News Network. We're going to get to those here in just a little bit. But 8% of U.S. People in the U.S. actually consider themselves golfer. Of course, I'm part of the 92%. I can hang. I always say I can kind of hang when it comes to golfing, but we'll see. We're going to find out today. This morning, I'm also joined by Dr. Luke Thompson. He's a sports medicine physician. He treats everyone from the pro elite athletes to our high schoolers, our kids. Good morning to you. How are you?
Good morning. Doing well.
Good. Are you a golfer?
I say that I am, but I probably get out 4 or 5 times a year.
Right. Like I said,
I enjoy it.
You play exactly. You get enough. No pressure. You're not going to Augusta anytime soon. So
just as a fan, hopefully.
Exactly. Yes. Would that be fun? Okay. So let's just start out. First, help us understand what sports medicine really entails.
Sure. So basically, sports medicine is just taking care of the active population. So everybody from young kids and their 5, 6-year-olds all the way up to 80, 90-year-olds that are out doing stuff and want to keep themselves healthy.
So you work a lot with pro athletes. You work with the Chiefs when need be, and of course our high schoolers and kids. Even you said as young as 6 years old. What's the same and what's different?
Fortunately for us, a lot of things are the same. It's just a different stage. There's very similar injuries on a Thursday or Friday evening at a high school game as there are on a Saturday morning or on a Sunday afternoon, and so we get to use, being a part of this health system, we get to use all our resources to take care of the kids, to take care of the parents, to take care of the elite athletes in a very similar way. Just with all the machinery and the technology we have to use.
Well, and how important is it to be thinking about injury before they actually happen? We're talking about the golf analysis today, which can help avoid injury. Are parents and our athletes thinking about those things ahead of time now more and prepping and trying to avoid the injuries before they come your way?
Yeah, I think they are thinking about it more, but there's still more that we can do. I mean,
right.
Making sure that you're preparing to use your body in a way that you're asking it to be used is essential. Kids are playing sports more year-round now, so they're constantly throwing, they're constantly shooting, they're constantly, working out, and so we have to be real careful, especially in the younger kids, to make sure that we're not seeing those overuse type things that occur. And so taking breaks here and there is actually a good thing in that situation.
So it doesn't feel like spring outside right now, as we know.
I had ice on my car this morning.
Right, no, it's on its way. We promise. So people are going to want to get outside more often. I'm a gym user. I go to the gym. I like to use machines. But how do we avoid injuries when we're in the gym using machines and staying safe outside when we're kind of doing it all natural?
Yeah, well, I think anything that you do, certainly in moderation, and then a variety is actually beneficial. As we were talking about, doing the same thing over and over again gets you to that point where you might have an overuse injury. And so doing things in the gym, doing things outside, switching up your routine just a little bit, kind of shocking your muscles a little bit, but easing into those activities is a great idea. So certainly, taking your activities from the gym, modifying them, being able to be outside and be exposed to fresh air and vitamin D is essential.
And let's talk about that. We were talking about that before we went on air today. Just taking vitamin D a little more seriously, actually part of your health regimen.
Yeah,
right.
Yeah, no, we're finding that it has a lot of health benefits. Certainly, like I was talking about, if there's anything, moderation. Going out and getting sunburnt every day is not recommended. Just being exposed to the sun, getting a little bit of the sun's rays is for sure helpful.
Yeah, doing it in a healthy manner. So let's talk about it, because I know you treat the Chiefs again when they need to be treated. But what about the rest of us?
Yeah.
Non-pro athletes. What is some good exercise advice you have for us?
Yeah, I mean, I think just getting in a situation where you are exposed to exercise on a regular basis, you have the ability to work your body regularly. Us weekend warriors, 40 plus or minus, when we go out and we just play softball on a Saturday afternoon and we go from 0 to 60, those are when those injuries occur. And you get the ankle sprains, the knee injuries, the Achilles injuries, the shoulder injuries. And so making sure that daily you're doing something to train those muscles is the way to prevent injury in a weekend warrior. As opposed to a kid who's so active all the time, we see kind of the opposite problem. We see those overuse injuries where they're throwing 100 pitches a day, and then they start to have a little bit of elbow soreness or shoulder soreness, or they're out running and jumping all day, and so they're getting knee soreness. And so finding those activities to just supplement your exercise as a kid is essential too.
Well, and especially people are living longer, and they're living longer because they're working out. But if they want to keep working out as part of their lifelong goal, they have to make sure that they're taking care of themselves along the way, right?
Yeah, for sure.
All right, so I think over your shoulder they're teeing off in Augusta. So let's talk a little golf. You say you hit the golf course a few times a year when you can, just for fun.
Yeah.
We've always thought of golf as, okay, how hard can that be? We know it's a mind game, but, when Tiger Woods came along, that really changed the sport. And from going from, I call it kind of the John Daly days, where people were, cracking open a beer on the golf course and competing, to a real athlete that's actually putting muscle on and really conditioning. Talk us through that, how that's helped the game.
Yeah, I mean, I was actually thinking about that the other day before you even said it. When I was watching yesterday, just the shape of the athlete has sure changed since Tiger Woods came in. I was thinking about the Tiger Woods is 46 now, and he could be on the Champions Tour soon, and he still looks like he's in great shape, and had a serious injury, not that long ago. And so, those guys are definitely making sure that their bodies are tuned in a way that's going to give them great strength, great flexibility, and let them hit the ball.
Now great strength can also, you're hitting so hard that can cause the injuries because you're so well conditioned.
Yeah, and as an athlete that's more of a weekend warrior, or somebody that goes out and plays golf a couple times a week, keeping your flexibility up and keeping your mechanics good, as you guys are going to look at here in a minute, is essential for minimizing those injuries. But doing it regularly will help keep you from having those acute injuries that occur too.
So without doing those stretches and some of those off day exercises that you're talking about, what actually physically on the body, what kind of injury could happen if you're not prepped and ready properly for golf?
Yeah, well, there's quite a gamut, but a lot of things that we see are when initial injuries occur that are acute injuries for a golfer, you're talking more about kind of avulsion type things or quick movements that cause abrupt stops. And so if you're swinging, you're hitting into the ground. Or we see some overuse things with regular golfers too. There's a reason there's something called golfer's elbow. You've probably heard of tennis elbow. There's golfer's elbow too. But it's actually just elbow pain on the other side that's from inflammation and overuse. So we do see that as well. But those things occur typically because everything's not just trained quite right. And you have some muscle groups that are strong and some muscle groups that are weak. But if you can strengthen all those muscle groups and have them work together, which is, something you can do here at a performance center like this, that's when you're going to mitigate those injuries.
Okay, great advice. Alexis, I'm going to send it back to you because I'm sure our community has questions, whether it be about sports medicine or COVID. If you've got any for us out here, let us know.
Will do, Jess. I'm getting excited to see how she performs with her swing. I think she's going to do great. I do. She's hard on herself, but she I have a feeling Jess is a good golfer. So I'm here with Dr. Hawkinson, and we've been talking with people and telling you since the pandemic began to spend more time outside, and which is such a good thing, and so many more people are doing that. We also have new variants that are popping up, like BA2. What do you recommend, Dr. Hawkinson, when it comes to protecting ourselves outside with the new variants?
Yeah, I mean, nothing has really changed. Continue to be outdoors in those good ventilated areas. Obviously, if you're outdoors, you are. We know that some places have, like if you were to sit down and eat, under tents and things like that, those are still very well ventilated areas. But if you're doing activities outdoors, which we have really promoted since day one, getting out, walking, playing golf is safe. You are outdoors, you are probably going to be 6 feet or more away from somebody, and just with all the air current and things of that nature, you're going to be very safe. But of course, we always need to continue to endorse vaccination, and I think that's very important as well. So continue to be up to date with vaccination. But if you're doing these activities outside, no matter what they are, even if they're team sports, you're going to have very low risk or little risk of infecting others should you be infected, or getting infected yourself if you're doing these activities outdoors.
Which is great news for golfers.
Yeah,
you're
absolutely.
Golfing outside. When it comes to clubs and carts, you're not always golfing with people that in your party that you came with. Sometimes you go on your own, get paired up with someone else. So what's the best advice you can give to golfers when using clubs and carts and golfing with people not in your bubble?
Yeah. Again, I think we still have to go back, be vaccinated, be up to date, be protected. Still, I believe that when you're doing these things outdoors, I know you're going to be in a golf court. You're probably going to be a golf cart close to somebody doing that. You certainly can always wear a mask. If you ever feel uncomfortable, you can always still wear that mask. But for the most part, you are going to have very small amounts of time that you're going to be with that person in that golf cart. And again, with the turbulent airflow that is going on outdoors, you're really going to be very protected and very safe.
Do you still recommend wearing a mask if you're with people sitting next to the cart, sitting in the cart together, and it's not someone you live with?
Mm-hmm. Yeah, again, I think we have to take into account what is your level of risk for severe disease. What is your vaccination status? Have you had your booster? Are you up to date with your vaccination? If you are up to date, I truly believe that you should be allowed, and we use that word allowed basically based on your risk for severe disease. You should be able to go out and do those things and get back to some sort of normal sense or normal life prior to like it was prior to the pandemic. So just take into account your risk for severe disease. Understand that if you're vaccinated and up to date with your vaccination, you are going to be very well protected. You certainly can wear a mask, but that is something that you have to judge for yourself and make that assessment yourself.
One of the beauties of golf, as we're doing this show surrounded, on the golf theme, is that you can do it at any age. It's one of those lifetime sports. A lot of people who are 70s and older have taken up the game in the pandemic, trying to get outside, do something new. The FDA has recently said that anyone 50 or older should get that second booster shot. So what do you think about the second booster shot for people who are 50 and younger than 50? I mean, when is that going to be allowed?
I think just the FDA and the CDC following suit and saying or recommending that second booster for those over 50, I think it's important to understand that there is still a lot of expert opinion which differs.
Right.
Because we know and understand, and there are some experts who continue to say and believe that if you've had 3 exposures to spike, whether that is 2 vaccinations and a booster or 2 vaccinations and an infection, those 3 exposures provide with enough immune boost and memory B cells and memory T cells that you are still well protected from what? Well protected from hospitalization, severe disease, and death. And that's what those vaccinations are for. And so I think the other thing you have to consider is that those younger populations are less at risk of going to the hospital,
Right.
of going to the ICU and dying. And so for that reason, right now, those have not been recommended. We knew the FDA met this week to decide how to move forward with recommendations about additional vaccine doses. Nothing is really identified yet. There is no plan yet. Again, we still have to see what the data is, where the trends go. But, you know, for those over 50, and again, take into account your risk and how far you are out from your last vaccine dose. Some of the experts, again, continue to say, well, you still are very well protected against hospitalization. We know that there is some new data from Israel. Some people do have problems with that data, but what it did show that those people that got that fourth dose still were able to protect themselves up to 90% or more against hospitalization as compared to, say, 75 to 80% protection, which is still very good. But if you're dealing with an individual and you can reduce your risk of hospitalization and go into the ICU as much as possible, having treated people before vaccines were available, having treated people now and understanding those who didn't get vaccinated and wondering what they could have done, I'm certainly a proponent of trying to reduce your risk of going to the hospital and ICU as much as possible.
One more question for you, and I'm going to combine, we get a bunch of questions on this topic today.
Yeah.
Specific to this, and people are asking it in different ways. If you got Moderna for your first 3 shots,
Yeah.
should you get Pfizer for your 4th? And then if you got Pfizer for your first 3, should you get Moderna for your 4th? And I think they're asking this because there have been recent studies and reports that we're seeing on the news that you should mix up that final booster to get some extra stuff that you might not have gotten with the first one.
Yeah, you know, if you got Pfizer or Moderna, the recommendation is to stick with those.
Oh, still
those
stick with
still
it.
do offer
Okay.
very good protection, even though, you know, they're all the same. If you have to, and you can't, you're because of maybe where you go to get the vaccine, they only have one companies rather than the other. You are allowed to mix and match. Now, if you did get Johnson & Johnson, they do recommend those mRNA vaccines for the boosters.
Oh, that's interesting. So your recommendation is not.
Yeah, I mean,
to
the
mix and match.
Pfizer and Moderna vaccines are essentially the same. There are
Got it.
minute differences. So if you got Pfizer, you certainly can stick with that. If you've got Moderna, you can stick with that. I know that I've stuck with that one company just because that's what we have here. That's what
Got
we've
it.
been given. But if you happen to go to your pharmacy or your doctor's office, they still have the company that you got initially. Go ahead and get that. If they don't, and they have the other one, you're able to get that. You're able to mix and match in that manner.
Dr. Hawkinson, I think we're gearing up to go back
All
out
right,
to Jess,
this will be fun.
who's at the Sports Medicine and Performance Center, hoping to improve her golf swing. Jess, can't wait to see it. This is the moment of truth.
It really is. It really is. Yeah, we're out here live at the Sports Medicine and Performance Center, where I'm about ready to do a golf analysis where Ryan Sloop, he's the director of the program, he's going to tell us hopefully everything I'm doing right. You know, so, but before we do that, Alexis, I will not make you wait any longer. Take a look at this. I honestly was going through my phone and I found this footage of me out on the golf course. So take a look and then I'll let Ryan decide.
I was practicing. Shit, fuck.
Okay, there you go.
Great ball. Great ball.
Yeah,
Right.
Who said great? Who is it? The person taking the
Hey.
video?
probably.
I said I could hang. I said I could hang. And so
You
Ryan
can.
Sloop, he's the director of the program out here. How did I do?
That looked great. That was a good strike, good posture, and good movement through the ball.
First time doing it, right?
Yeah.
That was perfect.
Yeah, perfect.
Okay, so let's talk a little bit about this swing analysis program. Who's it available to? And then we're going to walk through the process.
So this is called the K-Vest Swing Motion 3D Swing Analyzer, and we've treated and seen golfers as young as 13 all the way up through 85, I believe. So what this technology allows us to do is to kind of see how your body is moving through the golf swing in real time. It gives us live feedback, so it can kind of tell us how the different segments of your body are moving at different points in the swing, so we can kind of improve efficiency and make sure that the things that are supposed to be moving are moving, and the things that aren't supposed to be moving are kind of staying stable.
Right, and so we of course wanted to help your golf game, but
Correct.
really helping to keep injury away, correct?
Correct. So this is a very versatile piece of technology. It's used by both fitness, medical professionals, and teaching professionals alike. We use it here more to improve your physical capabilities. We're not trying to change your swing per se and make you a better golfer in that sense. We want to give you better physical tools so that you can perform better out on the course.
So people aren't paying you to help them get to Augusta?
Unfortunately not.
Okay, all right, because that's a big job. Okay, so can anyone partake in this?
Absolutely.
Okay.
So we have a golf fitness evaluation that's a one-on-one 90-minute appointment, and you can call and schedule anytime.
All right, so you got me all hooked up.
Yes.
Tell 4 points of hookup. Tell
Yeah.
them what you did to
So
me.
we've got 4 Bluetooth sensors that are picked up by our Bluetooth receiver here.
Okay.
The first one is going to be around her pelvis and core here. The second one on her back, up around her thoracic spine, where we get a lot of our upper body rotation. The third one is going to be on her lead elbow. Okay, that's kind of the driver of the upper body swing, and then down on the wrist and hand of the lead hand as well.
All right. So now what do we do? What's next? Okay,
So,
then tell people what we're going to be able to see.
So like I said, this gives us real feedback. You can see her avatar is moving as she moves. And we've got some tile metrics up here. So after she takes a swing, we're going to be able to see what's called the transition sequence. So we're going to be able to see how each segment moves and in what order, because there is actually a correct order your body is supposed to move in.
All right, should we just jump right in?
Absolutely. So let me click a button and then you'll be ready to swing.
And I'm going to swing at my full.
Absolutely. We want you to
force.
swing a regular, normal swing as if you're on the golf course. Go
Okay.
ahead. You're ready.
Okay.
It's all right. Now, it takes a second to think, but once it beeps, you can swing again.
Okay.
There we go. Go ahead.
Beeped.
Good. That was a better swing.
So after each swing, you're looking at
I am looking just to kind of look for consistency to see if each swing is kind of giving us the same results or if you're kind of all over the map. There you go.
So can you tell anything?
Yes,
What am I doing wrong? What am I doing right?
On that previous swing, your body was in the correct transition sequence, so
Okay.
That's very good. And truly, we don't care about
little divot.
Yeah, a little divot there. Hit that one a little fat.
Thank God this isn't real grass.
So we can see here on that particular swing, her pelvis was the first segment to move.
And what's it supposed to say?
It should be 1, 2, 3, 4. So we're at least kind of in the same order, but that just means your pelvis and your torso
Okay, so
kind of
let's
moved
see.
at the same
I'm
time.
going to do it. Clip, keep it there. Let me see if I do it right this time.
So it'll take a second to kind of calibrate. And there, that was
1,
proper
2, 3,
sequence.
4, baby,
Exactly.
right
Very
there.
good.
I'm
Nice
done.
job.
My work is done here.
Yep.
I mean, it's perfect. All right, I'm going to try this one more time, Alexis. 1 for the road, 1 for the weekend. And then, Alexis, you're up next. I'm getting you out here.
Great strike.
Is it good? All right. My work is done here, guys. Thank you so much for this. This has been fantastic. I'm going to send it back to you, Alexis, so you can kind of wrap us up for the weekend. And just, I want you to have a great weekend. Have a great Friday, everyone.
Well, how convenient. She's golfing and
Right.
she's done.
Yeah.
Heading into the weekend. We're never going to see her today. First, wait. First, she leaves us
Right?
high and dry eating that delicious sandwich in
Yeah,
the K.
that was-
Now she's golfing. All right, Jess, have a great. I think it looks good to me. I've never golfed before, but looks good from this.
Looks like
from the
master's
cheap
level
seats.
to me. Yeah, exactly.
Master's level. All right, Jess, have fun. We do have some really good community questions that are coming in, and they're all for Dr. Hawkinson, so let me just pull it up. We have a couple different questions about kids ages 5 to 11, when they'll get a booster, and then another question from Melissa on when can kids 5 and under get the vaccines.
Yeah. So the 5 to 11 booster, and remember, boosters can be given from 12 and up if you are 12 years old. And this kind of goes back to that first question we had. If you are 12 years old, 12 to 18, you should be getting that Pfizer dose, even if you got Moderna first. So everybody 12 and up can get a booster. Those kids 5 to 11. There's really been no data and no speaking about exactly when a booster will be available or even if needed. Again, I mean, thankfully, since the pandemic began, we have understood that children do suffer less than the adults or older ages as far as severity and long COVID, but we know they can get all of those things. So, but right now there is really no good information on when 5 to 11-year-olds will be able to get boosters, or even if it's needed as well. When will children 5 and younger be able to get the vaccination? You know, we were hoping and thinking it was going to be in the spring. It seems to always be pushed back. They are continuing to analyze the data and finally make those recommendations, but I haven't heard anything more other than a few weeks ago when they said, well, maybe it'll be April or May. Obviously, we're in the middle of April now, so we are still waiting for those final recommendations.
Melissa wants to know, or actually, no, this is Neva. Neva would like a clarification on why the testing is changing, and I think she's talking about here at the University of Kansas Health System, the COVID testing protocol. Yeah,
absolutely. I think that's a very good question. I think because it is such a departure from what we've been doing these last 2.5 years. So what we are dealing with now is that overall the cases around the United States are going down. The cases in our community have been lower. We know that there hasn't been that surge. We know that other places around the metro and the communities have also stopped that. We have taken into account the fact of how many people have either spread it to each other in the hospital, whether that's workers spreading it to patients or patients spreading it to the workers, things of that nature. We are still wearing our PPE. We are still wearing our masks and things of that nature, so that will keep you safe as well. So I think mostly it is due because of, number one, the community activity of the virus. We know that it is still present, it is endemic, but it is at a lower level. The other issue we have is that you have more immunity, population immunity, with people getting vaccinated and infected or reinfected, things of that nature. But a lot of it has to do with the actual community levels. Now, certainly we can pivot back to testing all admissions, and if we see a surge in cases and hospitalizations, we will certainly do that. But right now, with the low level of community transmission, we believe that it was a safe time to go ahead and make this pivot to stopping universal PCR testing for all admissions and really only testing those people that we have suspicion of having disease.
Joe Ellen has a question. I think this is super interesting. Would it be possible to get a vaccine to prevent infection as opposed to preventing hospitalization?
Well, you know, certainly what we have seen that people who have been vaccinated, whether it was the initial vaccine time period where it was just 2 doses, whether it was the time period of the 3rd booster and now this 4th booster, you know, we have seen evidence and data signals that support the fact that if you are 3 months or less out from that vaccine dose, you actually do have protection against infection. Now, of course, that was a time when a lot of people were wearing masks, and so masks are going to help the wearer reduce their chance of infection as well. But if you are looking at that, you are looking at what we are calling sterilizing immunity from that vaccine. Really, no vaccine has offered sterilizing immunity, meaning it blocks infection. So there is some protection from infection, but overall, as you get further out, especially more than 3 months, that protection does decrease. So really what the main goal of almost all vaccines are to prevent those disease states, especially those severe disease states. And that's what these vaccines continue to do very well.
Selfish has a question, and I've actually had the same question. Is there any way to tell if anyone in your house has ever had COVID? I'm paraphrasing.
Yeah.
Cell doesn't think that anyone in their house has had it.
Yeah.
Is there a test we can take to find out?
Yeah, there are. So if you've never been I think we have to understand, are you talking about a household that's been vaccinated or an individual that's been vaccinated or unvaccinated? Certainly, you can, if you have been unvaccinated, you can go to get to your doctor's office or lab and just get a test for the antibodies. Now, if they're negative, that may not mean that you have not been infected, but those antibody levels have waned. So antibody testing, if you've been vaccinated and you want to see if you've ever been infected, you can seek out a lab that tests antibody to N protein, which is just a protein on the virus, which is different from the spike protein. And the spike protein is, of course, what we got from the vaccine.
Okay.
So if you do the test for the antibody to N protein and it's positive, then you can understand it and realize that you had the virus, but maybe you didn't know it. The other thing you can do is there are T cell tests as well to look at your T cells to see if you've ever had exposure or infection from the virus too. Those are a little bit harder to come by and maybe more expensive, but there are ways. But again, nothing is 100%. And you have to understand, have you been vaccinated in the past, or are you unvaccinated as well?
So you'd have to go looking for those tests.
You would, yeah. But there are ways to see if you've ever been exposed or infected for sure.
I think Jess wants to touch base with us one more time. She's out in the field practicing her golf swing. Jess, what's going on?
Well, we're just back. I just wanted you to watch and take note.
Oh, okay.
So you could, yourself know the perfect golf swing.
Okay.
I mean, I really don't even need any analysis. I think Ryan's going to hire me just to, do my thing out here. Ow. Okay.
Uh-oh.
So I just want to.
Man down.
Fun, actually.
Hernia.
So
Hernia.
So, okay, I'm going to send it over to Dr. Thompson just for a quick final thought about just, everyone getting out and staying safe and staying active.
Yeah, for sure. I might be in the danger zone here.
Yeah.
I wouldn't recommend standing in this location when you're next to a golfer, but she's got a pretty good serve, so I think we're in good shape. But, for sure, getting outside, the weather's, I think, going to get nice here. Making sure you're eating healthy, drinking plenty of water. That's going to prevent you from getting any type of injuries or at least help. If you're going out golfing, if you're going kayaking, if you're going to go out and run a marathon. So for sure, stay active, be healthy. And if you need help, we're here at a place like this or even in our clinics if you've got an injury.
Yeah, Ryan, again, thanks for being with us today. Just tell folks how they can contact you if they want to come out here and do this.
Yeah, so to sign up for our golf fitness and injury prevention program or any program here, you can give us a call at 913-574-1240.
All right, I'm just checking to see. Hold on. Ooh, not good.
That one was a little out of sync.
Ooh, out of sync. Okay, I'm going to stay here and get in sync. All right, guys, I'll send it back to you. Have a great weekend, guys.
Well. She told us to take note.
Right.
And she's out of sync. I like this.
I spoke too soon.
I think it looks great. We're going to let Jess keep having fun out there,
Yeah.
Practicing her swing. Thank you so much for being with us today. And remember, you can watch us anytime on Facebook, YouTube, and Twitter. Have a fantastic weekend. We will see you right back here Monday at 8 a.m.
Coming up Monday on the Morning Medical Update. Frizzy hair, fast heartbeat, exhaustion, signs of stress and burnout. If you're feeling like that, you are not alone. What the experts say can help you feel healthy and better again. Join us at 8 a.m. on these social media platforms.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stein's podcast. Now, everywhere podcasts are available.